use of digital platform, adequate community engagement, and situational analysis are major tools that the Health Cabinet Secretary nominee Dr. Debra Barasa intends to use while leading the ministry if approved. Debra vowed to flush out cartels at the Afya House by sealing all corruption loopholes. Dungo Pauline followed the proceedings and filed the following report.
Will you support if confirmed to create...
With the health docket having faced an array of challenges and its fair share of scandals, Health Cabinet Secretary nominee Dr. Debra Barasa was second in line in today's schedule of CS vetting. During her time before the committee, Dr. Debra Barasa outlined several measures she intends to implement during her time in office. In curbing theft from the NHIF, Dr. Debra, who is also a qualified medical practitioner, urged the need to reduce human interaction by introducing use of digital platforms for ease in monitoring activities.
Mlongo Barasa. I am a qualified medical doctor. I have more than 18 years medical expertise and public health professional background.
If approved, Dr. Debra, who takes the mantle from former CS Susan Nakumincha, will be tasked with overseeing the implementation of the new Social Health Insurance Fund, a project whose rollout has been in the pipeline for months on end. According to Daktari, one of the challenges that hamper the Social Health Insurance Fund was inadequate public participation, a situation that has had the public blind to the vision of the fund.
The challenges. We need to look at the misinformation and counter it. We need to engage the community. And one of the people in the community that we can use are the community health promoters.
In dealing with the cartels at Afya House, Dr. Debra assured of her strategy as she says that she will focus on prevention rather than cure. This in the face of doubts raised of her ability to handle the mafia that have haunted the Afya House for years now.
So again, a consultative approach. I believe we need to involve the national team as well as the county government to have open dialogue and come up with interventions. We need to look at the situational analysis and see where are the strengths, the weaknesses, opportunities, and threats. And from there, we need to come up with priority interventions. So I'm coming out of the government, but I believe having open dialogue, having consultations, and coming up to ensure we understand where the national team stops and where does the county begin.
Barasa, who is an infectious disease expert with more than 18 years of experience in the healthcare industry, has promised to work with high integrity according to the law if approved. The nominee Health Cabinet Secretary Debra Mlongo Barasa will be taking over from the former CS Susan Nakumincha, who was sent home on 11th July by President William Ruto. Ndongo Pauline, KUTV.